Well, thanks, Adam. Thanks, everyone, for joining. I'm with the Allianz Advanced Markets team. So I've been taking questions on Social Security now for over 12 years. So I'm not saying I'm going to know every question thrown at me, but I've heard a lot of them. So if you do have questions, just throw them into the chat. I'll try and answer them as best I can as we go along here. So tonight we're going to be talking about Social Security and the 7 keys to enhancing your benefits. Social Security provides a lot of different options. Many believe it's cut and dried, but it actually can get a little complicated. And it's one of the biggest financial decisions you'll probably make in your life is when you're going to start claiming benefits and taking into account not only your own situation, but if you're married, divorced, widower. There's a lot to talk about today. So we're going to get into it and we're going to talk about just some of the benefit basics, income benefits, when to start benefits, the big question for many of us. What happens if you're working in retirement and collecting Social Security? We're going to talk about taxes, spouse and survivor benefits. And at the very end, we're just going to touch briefly on Medicare. So it's more than just a retirement program. Right now, there's about 68 million people collecting on Social Security across the whole US. And the bulk of it is who you would expect it to be, the retired workers or their dependents. About 12% going to folks that are disabled or their dependents. And about just under 10% is going to be survivor benefits. So sometimes, if your spouse made a higher benefit than you would step into their higher benefit at their death. And it's the biggest government program out there. So last year, it paid out $1.2 trillion in benefits. That's 1.2 with a T, not a B. And you can see here, this is across the entire US. Your average retirement worker benefits at just under $2,000. If someone is disabled, a little less than that, about $1,800. And for those that are widowers, or your parents even can qualify off of you, about $1,500 in benefits. Hard question to answer. Will it be there? So last major Social Security reform was done in the early 80s. That was with Ronald Reagan, Republican president, and Tip O'Neill, Democrat Congress, Speaker of the House. And they didn't like each other too much as far as I understand it, but they were able to get together and shore up the Social Security program by making a bunch of changes to it. Some of those changes are still getting phased in today as we, approach 40 years after that happened. But they clearly need to do something with Social Security. Current estimates have it being the trust fund running out sometime in about 2035. That number's kind of moved around over the years, depending on how much payroll tax is going into the system. It's not like it's going to disappear. I do believe that President, Congress will eventually figure out something to do with this. And if nothing is done, nothing changes, it's not like it just disappears. Current payroll taxes, expected payroll taxes in 2035 are expected to be able to cover about 83% of the benefits. I think even in a worst case scenario, can't possibly believe Congress would let benefits get cut 17%. I imagine they would just fund it out of the deficit and debt and make sure everyone's whole until they do to make some changes. But it's not like it's going to completely disappear in 2035. So I just want to touch on that briefly and try and allay some concerns that people have about that. So one of the things I suggest everyone here do, if they haven't done so already, especially if you're approaching retirement and considering when you're going to file for benefits, go on to ssa.gov and create an account. They're going to ask you a few questions. I've done this myself. They actually know quite a bit about you that you might not think they know. Like they might ask you what kind of vehicle you purchased in the early 2000s and took out a loan for. So they do a pretty good job of making sure you are who you say you are. But once you get through, they've got some great information there. So they've updated their statements. These are mailed out to everyone once they turn age 60. But it's going to be the basis for what you can do here with Adam. If you want to have them sit down and go through your situation and run it through, we have a great Social Security tool on our website that Adam has access to. And you're going to need your full retirement age. That number will be on this sheet. It'll also tell you how much, if you were to become disabled, what your benefit would be at this time. And it also, you can't really quite see it here, but it also has your earnings history throughout your life. And so it's not common, but sometimes there is missing information there where your W-2 information didn't make it to Social Security for some reason. So the chance to identify that and get it corrected ahead of time would also obviously be a good thing. So there was some changes to Social Security. This actually happened this year in January. Joe Biden signed the Social Security Fairness Act. It is retroactive all the way back to January 1st of 2024. And this is not going to affect everyone on the call today, but if you worked in one of the states through the local government or federally, and you weren't paying into Social Security, so you had a pension that was provided to you, but it wasn't covered by Social Security, there was windfall elimination provision reductions in your own benefit, and your spousal benefit was reduced by the government pension offset. Those no longer apply. And I saw it was something to the tune of like 110,000 people in Florida were positively affected by this change. So the good news is if you were not paying into Social Security working as a teacher, fireman, police officer, some of those types of jobs, you should have seen your benefit go up by now. I've heard from Social Security that most of those people have been paid a back pay from those reductions, and going forward, they should be getting their higher amount. And of course, this may accelerate the depletion of the Social Security Trust Fund. So more money is going out effective January 1st, 2024. All right, how to qualify for benefits. So you do need 40 credits. That's equal to about 10 years of work, all right, to qualify for a benefit. One credit is earned for every $1,810 you make, and you can get 4 credits with just $7,240 of income. And they call them credits that you get 4 per year, but it doesn't have to be per quarter. So let's say you're working part-time as a contractor, you get paid for a job, let's just say it's $10,000 all at once in March, you would actually earn all 4 credits for 2025. How are benefits calculated? All right, so this part starts to get a little bit confusing, but I'll go through the basics of how this works. So what Social Security does is they have what they call your adjusted monthly income. They take your highest 35 years of earnings, they index them all for inflation. Okay, so if you had earnings from the 90s or 2000s, all the way up to now, those are put into today's dollars. Okay, they take that average income from that monthly earnings, and they take 90% of your first $1,200 or so that is replaced, and then it's about 32% from $1,200 to about $7,391 of income, and it replaces about 15% for anything over $7,300. So they take your highest 35 years, they index them all for inflation, and that is how they come up with your monthly earnings amount. For 2025, the highest monthly benefit you could get is about $4,000 at full retirement age. And full retirement age, we're going to have some slides on that coming up. If you take your benefit prior to your full retirement age, as early as 62, your benefit is reduced. And if you wait till 70 from full retirement age, it goes up by 8% a year with delayed retirement credits. So Social Security. Earliest you can file is age 62 on your own benefit amount. A widower can file as early as age 60. And this goes back to that 1980s reform that Reagan had done. So it used to be full retirement age was 66. Previous to that, it was 65. But they started sliding back your full retirement age, beginning in those born in the year 1955. And so we're almost to the point now where everyone, I believe, who is 65 or younger, their full retirement age is going to be 67. And the reduction in benefits went from 25% reduction up to 30% reduction. So if you look at how future reform might go, we might see some version of this coming into play again. But you can see here, the longer you wait, the more of a benefit you can get. We've got just a simple illustration here. This is always one of the toughest questions. When should I start taking benefits? Now, these numbers are an average of $2,000 a month, full retirement age being age 67, and we're not adjusting it for a COLA. The cost of living adjustment comes out each January. And this is just kind of a sliding scale of what amount you would have collected if you filed as early as 62. So by age 70, you would have collected 134,000. Again, 2,000 a month, no cost of living adjustment. And then obviously, if you waited till age 70, you would have collected nothing. And the point here is that Social Security is actuarially weighted so that it really doesn't make a difference across the whole US, whether you file at 62 or you file at 70. It's designed to pay out about the same amount of money if you live to life expectancy. So you can see here that at age 80 or so, we can start seeing some of these delay benefits being higher than the filing at 62 benefits. So that's kind of the break even, is between 80 and 83 for most people. And you can see by age 85, it definitely paid to wait. And if you have higher life expectancy, if it runs in the family, it can pay quite a bit more. And so when I'm thinking about this for my own personal situation, I make more than my wife. Whenever I pass away, she will step into my higher benefit. She's 2 years younger than me. And the key thing here is she had two grandmothers, both live past age 100. So she obviously has longevity in her family. She's in good health. It's going to probably be, my responsibility to wait until 70 to maximize that benefit that she can step into. And so not everyone, is able to wait until 70. I always, hear stories if someone's in the trades, if they're a contractor, a plumber, their back or their knees, hips might keep them from working. They might need to file for benefits at 62 because they cannot work to age 65. There's no perfect or right answer. We actually saw a surge in people filing in 2020, right? Due to COVID, a lot of people were let go. They didn't have adequate retirement savings. They weren't ready to retire, but they lost their jobs anyway. So there's all sorts of reasons why people might file early. It's not like it's the end of the world. But if you have the ability through savings and or ability to work, and you have longevity and good health, it helps, if you can wait. All right, we get a ton of questions on this. Social Security does not want you to have your full-time job and to file for benefits. It is a retirement benefit. All right. So they don't want you working full-time and collecting a benefit. But they also realize that a lot of people do like to work part-time. They want to get out of the house. Maybe they need a little bit of extra income. I learned, if nothing else, during COVID that I can't stay home 7 days a week. I need to get out and about. So whenever I do retire from Allianz, I do plan on working part-time somewhere, maybe at like a hunting store, talking fishing tackle and whatnot. But these are the limits here if you are working and under full retirement age. So again, for most people, that's going to be age 67. They're going to reduce your benefit $1 for every $2 you go over that level. So someone that made $43,400, you're 20,000 over the limit, you would have a $10,000 reduction in benefits. Okay. We've got an example coming up here as well. In the year that you hit full retirement age, so when you turn 67, they actually bump this up a decent amount. They reduce it only $1 for every 3 over the 62,160. And once you hit full retirement age, you can make as much as you want and not have a reduction in benefits. So they have this, they want you to use it as a retirement benefit, not when you're working. But if you follow these rules here, you'll understand what's going to happen there. So just a quick example here. We have Tamara, born in 63. She's going to retire partially at 62. Her Social Security benefit, so she's going to have a reduction, 70% of her benefit because she filed at 62. So her Social Security benefit is $16,598. She's making $40,000 this year. There's the limit again. So she's 16,006 over that limit. So she's going to have an $8,300 reduction in benefits. So she would only net about $8,300 from Social Security. And we do get questions on this. I do want to point it out. So let's just say she had half of her benefit reduced. Let's just say that that happens for 2 full years. So that over 2 years, she lost an entire year's worth of Social Security benefits. And then she finally retires at age 64. What Social Security will do in that situation is say, okay, you filed at 62 and had a 30% reduction. But in reality, you really didn't effectively retire until 63 because we withheld 1 year benefits. So they would apply that age 63 reduction, not the age 62 reduction. So instead of 70% of benefits, she might get like 75, 76% of her benefit. They don't pay you a lump sum. They don't pay it you back. They just decrease the level of the decrease you were receiving. So you get paid more once you finally do retire. So Social Security, it is subject to income tax federally. This is again part of that 1980s reform, and the not so great thing about this is that they never index these numbers for inflation. So you take all of your total income, that could be pension, IRA, 401k withdrawals. You have to add back in your non-taxable interests, i.e. muni bonds, and it includes half of your Social Security benefit amount. So that equals your combined income. If you are an individual and you add all of those three up and you're between 25 and 34,000, up to 50% of your benefit is subject to taxes. Married, filing, joint between 32 and 44,000. So it's pretty hard to stay under these levels if you add up half of a husband and wife Social Security benefit. One person could get up to $4,000 a month and put you right over this limit. And if you go over these two levels here, 34 or 44, 85% of your benefit is subject to Social Security taxes. Okay, that's not the tax rate that they're paying. That's how much is going to drop into your taxable income on your tax return. Okay, spousal and survivor benefits. So this is designed, if you go back historically when Social Security was set up, there was often only just a one earner household. A lot of times it was the wife typically who would stay at home and watch the kids, take care of things at home, and not have a work record where they were paying into Social Security. This works for both husbands and wives though. If you don't have a benefit of your own, you can collect up to half of your spouse's benefit once they've filed. All right. And the rules for this are pretty easygoing. You must have been married for at least 1 year or be the parent of a child, the same child. All right. So to qualify for spousal benefits, you have to have been married at least 1 year or the parent of the child. And they can get up to 50% of the working spouses or the higher earning spouse's benefit, as long as that other spouse has filed for benefits. You can file as early as age 62 if the higher earning spouse has already filed, but you're going to get reduced benefits. So it's 50% at full retirement age. It's going to be about 35% of the higher earner's benefit if the lower earner files at age 62. So if both spouses qualify on their own record, you're going to get the higher of your own benefit or half of your spouse's benefit. All right. So you see this oftentimes where people might be in and out of the workplace taking care of kids. They might have their own benefit. So let's just say my benefit is $1,000 a month. My wife, let's say her benefit was $4,000 a month. They would actually pay me my $1,000 benefit, and then they would add an additional $1,000 onto that. So total benefit would equal 1/2 of hers, or the $2,000 if I waited to full retirement age. Survivor benefits. So unfortunately, death is a part of life. There are survivor benefits as early as age 60, age 50 if you're disabled. So you can start collecting on your survivor benefit as early as age 60. you would get about 71.5% of your deceased spouse's full retirement age benefit amount. Every month you wait, it can go higher. And they do allow you to switch your benefits. So let's just say, for example, my wife were to pass away. Let's say I retired at age 60. Yes, there is the earnings limit for a widow or widower. Okay. So there, that 23.4 would come into play at age 60. So you can't work and collect the full benefit if you're over that 23.4. But I could theoretically then at 60 start taking a survivor benefit, get about 71.5% of my wife's benefit. And then since my benefit is higher, I could wait all the way to age 70, collect the survivor benefit from 60 to 70, and switch to that higher benefit on my own record at age 70. You can do it the other way around as well. You could file for your own benefit at 62 and then file for your full survivor benefit at full retirement age. So there is some flexibility there. And we're on to divorce spousal benefits. So this does happen. Unfortunately, divorce is a part of life for many. It's roughly 50% in the country, right? So if you were married for at least 10 years, you can qualify off of your ex. So the ex-spouse can start getting benefits as early as 62. It doesn't matter what the other ex-spouse does. So Social Security was wise enough that we didn't want a situation where someone waited till 70 to punish the ex. So if you're claiming off of their benefits, they just have to be 62 or older. All right. And it has no effect on the ex at all. So if the ex-spouse gets remarried, it does not affect them or their new spouse. You can claim on their benefits and not impact them in any way. And this isn't on the slide, but we do get asked this question: what happens if my ex passes away? I want to not make light of this, but there is the joke that the best ex is a dead ex. So if your ex that you were married to for at least 10 years passed away, you could get higher than the 50% of their benefit. It's like you were married at their death. So you can get that 71.5% at age 60, 100% at your own full retirement age. Okay. Moving on to Medicare. So we're just going to touch briefly on Medicare. We're getting close to the end of the presentation here. Medicare benefits start at age 65, first day of the month that you turn 65. If you're already receiving Social Security benefits, you're automatically enrolled in Medicare. If you are not receiving Social Security benefits, if you're waiting till 70, let's just say, you do have to enroll to receive Medicare benefits at age 65. They recommend you do that about 3 months prior to turning 65. There is a penalty if you do not enroll at age 65. So if you're trying to save the money, thinking you're in good health, they actually increase your premium for the rest of your life for every year that you wait. It's about 10%. There is an exception if you have qualified health insurance through work. If you are still working or you're getting benefits through your spouse who is still working, they waive that penalty. You can wait to enroll in Medicare if you have qualified coverage. So Medicare, there's several different parts to it. Part A is the free part, as far as there is no premium payment. There are going to be copays and deductibles, and that's going to cover things like hospitalization, hospice care, home health services. We always want to remind people Medicare does not pay for long-term care, nursing home care. So you should be talking to Adam about, long-term care insurance, or there are some life insurance and annuity riders that can help assist with long-term care like expenses. But Medicare does not cover long-term care. Part B, that's going to be your traditional Medicare. It does have a premium. If your income's under about $212,000, that first level of premium is about $185. It goes up from there. It's a graduated scale. The more you make, the more of a Medicare Part B premium. And that's going to cover things like, outpatient and certain related services, what you typically would go to the doctor for. Again, long-term nursing home care is not covered. Um, Part B does not cover things like vision and dental. If you wanted expanded coverage, you could not enroll in traditional Medicare, but take a Medicare Advantage plan out. Part C, you are going to pay a little bit more for it, but you're going to have, the more you pay, the more you're going to get. It is going to cover vision and dental. And then you also have Part D. So that came around in the early 2000s. That does cover prescription drug coverage. It is available for an additional premium. You don't have to enroll in Part D. And sometimes Part C includes prescription drug coverage. I'm not going to get into all the different types of plans out there. They're different in every state. They're even different from county to county within a state. So you want to talk to a qualified insurance salesman about Medicare options. So Medicare decisions, number one, how do you want to get coverage? Do you want to, go with the original Medicare, go enroll in parts A and B? Do you want to add a Medicare Advantage plan where you're going to have an additional higher premium than your Part B, but you're going to have more coverage, things like dental and vision and different in and out of network options? And then lastly, do you want to add prescription drug coverage to it? If you're relatively healthy and don't have a lot of prescription drugs, probably not. If you've got, a list of, things that you need to take every month, probably would make sense to enroll in Part D. And then lastly, if you go with original Medicare Parts A and B, they do have what's called a Medigap policy where you can add additional supplemental coverage. Again, there's a cost to it, but it can help cover some of those out-of-pocket costs and things of that nature. All right, so we got through it here. I definitely have time to take some questions if there are. Looking up here in the
Dave,
chat.
yeah, you can see it. Can you see the chat as well?
Yep, I can see it
Perfect.
here.
Great. Does Social Security disability income convert to full Social Security income at 67, or do you need to do something to ensure benefits are carried over to a surviving spouse?
Yeah, good question. So SSDI, that is your disability benefit. That does automatically convert at full retirement age. And so the benefit amount doesn't change. It just converts from SSDI to retirement income.
Perfect. Carol, yes, you can get a copy of these slides. They are client approved. So thumbs up, just reach out to Jesse or me and we can get that for you. And you just got to share it with all of your friends at work. Just kidding. You're welcome. One thing we had, or I know a while ago, David, it was going and then it got canceled, was the file and suspend. I know that's a done strategy now, correct? Is that the case?
Yeah, so that was a change they made. It was right around, I believe it passed in 2015. So it used to be a strategy available where you could have one spouse suspend their benefit, earning delayed retirement credits, and then the other spouse could file restricted. And so one spouse could get half of the one who suspended benefit. They both wait till age 70 and then turn on their higher benefit at 70 with delayed retirement credits. I'm gonna, it's a moot point, but it was deemed a strategy for the rich. I tended to disagree because if someone's getting a large benefit, that 4,000 or so, and they can grow it by 32%, I don't feel that that's as important as someone that was maybe making 2,000 that could grow their benefit 32% because that lower benefit individual probably had less in a 401k IRAs. So I thought it was advantageous, especially for lower earners, to be able to get that 32% increase from delayed retirement credits. But they ended it in 2016. So you had to have filed and suspended before, I believe it was April 30th of 2016. And you were grandfathered in if you were born in 1954 or earlier. Those people have all now turned 70. So that benefit is essentially gone.
Yeah. Perfect. Then we have another question here. Can you speak to the current discussions regarding changing the retirement age and what you understand the potential impacts could be And no, we won't hold you to
Oh,
it.
wow. If I knew that, right, I would know what all future presidents and Congress makeup was going to look like. Uh, I'm really curious myself. I'm 49 years old. I'm right in that gray area of, 2035. I'll be what, 50? Yeah, 59. So, um, I'm curious about this. I think people my age or older likely won't see changes. Again, what happened 40 years ago, it was a ways out because we haven't had anyone seriously discuss changing this since George Bush was looking at adding, possible private accounts to shore Social Security up. We don't have a lot of time to make these changes. I think what we'll probably see is, that 6.2% that people pay in and the employer pays in. I think you'll probably see that amount go up. I don't have any earthly idea what it would be. Maybe it's 6.5, maybe it's as much as 7%, to bring revenue in. I think if you're under age 40, there's a good chance that full retirement age might not be 67, that it might push out to 68, 69, even 70. Um, there's talk about, maybe we stay at 6.2, right now at about 175,000. You no longer pay into Social Security. What is that number here? I just want to make sure I get it right. 176,100. You no longer pay into Social Security. You've maxed out, if you will. You see all sorts of proposals about having that come back into play at like 300,000 or 400,000 of income. So I think we will see the full retirement age move back. I think you could see a bigger reduction, instead of 30, maybe it goes to 35% if you file at 62, and payroll tax increases. So
So you're saying that me being 52, I'm good then, right?
probably.
I'm just kidding. Let's see here. Got another one. Did we hear correctly that the max benefit is 4,000 a month? It varies based on income. But is that the cap? Can we see our projected benefit on the SSA.gov? Yes, Jen, you can see your projected benefit. And then what Dave's saying was, sorry, I just want to answer your question for you, Dave, but yeah, 4,000. That's if you wait for the full time and you have max age. But do you know, Dave, what is to her question? What is the max you've ever seen as far as a payout benefit? Is there an actual cap or is it really?
Yeah, so you will see some benefits higher than that. Typically the highest benefit. So if you paid in the max over the 35 years, um, you would be at that 4,000 level. So again, you would have had to have made at least 176,000 this year, and that number is indexed for inflation. So you're talking at a pretty good upper middle class, income your whole 35 years. Uh, you will see benefits higher than that with delayed retirement credits. It used to be you could delay from 66 to 70 and get a 32% increase. Now for those that are, 67, you can only get a 24% increase. So you're going to see some benefits that are higher than that, but not a whole lot.
Okay. We have a couple more here. How long does it take to receive benefits once you apply for Social Security if you've met all the full retirement age requirements?
Yeah, they suggest that you should apply about 3 months ahead of time. So I would say 3 months, you should get it. If you want to get it right at age 62, 3 months out, let them know. Um, I believe they can do it quicker than that, but it is, the government. So that if you know when you want to get it, I'd let them know 3 months ahead.
Got you. A couple of other things I wanted to let you know, guys. The chat box is here. Let's see, still going. Yeah, we will get you those slides for sure. Also, if you would like, any of your advisors here can run that Social Security optimization report here for you, so you can kind of work on those benefits and play with that a little bit, so you can figure out where your most beneficial time to file is. Also, regarding Medicare, as most of you probably know, one of our partners, Woody Turner, is married to lovely Gay Turner, and Gay and Woody's daughter-in-law Another Turner. They're Medicare experts. So we're going to be doing a Medicare planning webinar just like this. That's on October 16th. So definitely want to stay in tune for that. Also, we are going to do a very similar social security seminar with Dave next month. It's going to be live. So if you want to come out, meet Dave, ask maybe some more questions and hear the material again, just let us know. Shoot us your advisor or anybody here at the office an email, and we'll get you that invitation sent out to you too. Dave, I got one more question here. I think, guys, we're going to wrap up in a bit. So if you could throw your questions in there. This one, sorry, I'm trying to figure out how to. I'll just read it, and then you can tell me if you can decipher.
I think I've seen it, the one turning 67 in March.
No, it's the one up a little bit ahead where the spouse has passed. Reminder that the survivor's benefit is subtracted from the decedent's higher benefit and added to the lower benefit. Gross loss of 40%. Not 100% clear on that question. We can go to the turning 67 question, but I'll get that, Tal, I'll get you that answer to that question for you.
Yeah, essentially you get the higher of the two, okay, in total. So if one benefit was 4,000, your benefit was 2,000, you would end up getting the 4,000.
Gotcha. And Carl, it sounds like you could probably benefit from one of those Social Security reports. So just give us a call at the office, and we can jump on a Zoom or just run that for you as well and get you that information. Carl's question was as far as when to time the turning on of the benefit. We've got a couple other variables in there. I can retire at 67, then be able to work full time without any penalties. Yes, as long as your full retirement age is 67. Cool. Let's see. I think that's about all the questions we have for now, Dave. So I will look forward to seeing you next month.
All right, Adam.
Yeah,
Thanks
thank you very much,
joining.
everybody, for joining. And Dave, again, thank you for your expertise. We really, really appreciate that. And guys, if you want a copy of the slides, just let me know. If you want a copy of that report, let us know. Thank you, everybody, for joining us tonight. We really appreciate it. Thank you for your trust, your business, and we look forward to seeing you sometime very, very soon. Thanks, everybody. Thanks again, Dave.
Yep. Have a good one.
Appreciate it very, very much.
Thanks, Dave. Thanks, Adam.
Thanks, everybody.